Hi, thank you for watching Digging to China. I'm Dong Shang. This episode is about a pandemic and how we can learn from the most successful region. Taiwan hasn't recorded a locally transmitted coronavirus infection in about 7 months. You would expect health experts and the political leaders all over the globe want to learn from Taiwan, right? Wrong. Taiwan was blocked from participating in a virtual gathering last week of the WHO's World Health Assembly. Why? Because China objected. Because China considers self-ruled island is part of its territory. Talking about placing politics above health and human lives, look no further than World Health Organization. As of November 12, Taiwan, an island of more than 23 million people, had recorded 589 total COVID-19 infections, most of them imported. Among the key lessons Taiwan has learned, testing needs to be deployed in conjunction with an effective quarantine program. And making the program work isn't just about enforcement, but supporting those who are quarantined. Taiwan has proven that democratic countries can do this thing well. Taiwan's success provides a counterpunch to China's, which demonstrated that authoritarian governments are well equipped to fight the pandemic. Beijing does not want that. Chinese Communist Party does not want to look bad. Talking about placing political control above human lives, look no further than Chinese Communist Party. After getting a large outbreak in Wuhan under control at the start of the pandemic, China has repeatedly suppressed outbreaks by deploying a combination of mass testing, quarantines, and hard lockdown measures to wipe out pockets of the virus wherever they pop up. Chinese state media has pointed to the effectiveness of the country's response in contrast to democratic countries, where a deference to individual liberties has contributed to the spread of the virus. Taiwan has been sidelined by Beijing for years at the WHO. The island was barred from participating as an observer in the World Health Assembly. The US and dozens of countries have called for Taiwan's inclusion in the meeting, and yet WHO has yielded to pressure from China during the pandemic. Several internet users reported being blocked from posting comments containing the word Taiwan on the WHO's official Facebook page on November 12th. Taiwan's representative in the US, Bai Kim-hsiao, tweeted a screenshot that appeared to show her own failed attempt to post a comment on page asking whether the organization was censoring Taiwan. In a statement, the WHO said it sometimes filters its Facebook page to guard against cyber attacks by online activists that hinder conversation. It's been clear from the pandemic's start that China staged a shameful cover-up that cost lives across the world. Now, nearly uncovered details show that the World Health Organization didn't just kowtow to the communists. The UN agency actively helped Beijing whitewash its deadly deeds. The New York Times published a detailed report. It covered internal documents and interviews with more than 50 officials and scientists. The report summed up this way. As it praised Beijing, the World Health Organization concealed concessions to China and may have sacrificed the best chance to unravel the virus's origins. Back in February, WHO's Emergency Director Michael Ryan said it was critical to understand the virus's source, but the agency ignored the advice of its emergency committee in dealing with China and negotiated terms that sidelined its own experts. The New York Times reports, they would not question China's initial response or even visit the live animal market in the city of Wuhan where the outbreak seemed to have originated. Indeed, nearly a year and more than 1.1 million deaths later, there is still no transparent, independent investigation into the sources of the virus. In other words, WHO did China's bidding at the cost of more than 1 million lives. When Australian government called for such an investigation back in April, Beijing barred Aussie imports into the country, and still does. But WHO has been praising on China all year and claimed it was investigating the virus's origins despite knowing the Chinese Communist Party made any real investigation impossible. WHO leaders have largely ceded control of the investigation to China, but the agency has refused to disclose details of its negotiations with Beijing. Lawrence Gostin, a professor of global health law at Georgetown University, told the New York Times, I quote, "It was an absolute whitewash." In June, the Associated Press found WHO officials privately complained in January that China was not sharing enough data to assess how effectively the virus spread between people or what risk it posed to the rest of the world, costing valuable time. And yet, WHO praised China throughout January, thanking the country for sharing the virus genetic map immediately and saying its work and the transparency were very impressive and beyond words. In reality, Chinese government labs only released the genome after another lab published it ahead of authorities on a virologist's website more than a week after it had the genetic map. The delay in the release of the genome stalled the recognition of its spread to other countries, along with the global development of tests, drugs, and vaccines. AP investigators uncovered an internal notice in which Chinese officials in early January found that the coronavirus was contagious through respiratory passages. But WHO was saying that same day that information from China indicated no evidence of significant transmission between humans. Even now, nearly a year later, WHO continues its cover-up. Let us go back to Taiwan. Taiwan learned many lessons during the 2003 outbreak of severe acute respiratory syndrome, or SARS. The experience instilled in Taiwanese people a willingness to abide by health orders and wear face masks. After SARS, Taiwan revamped its health laws to give the central government more leeway to impose quarantines and fines to manage public health crisis. This time around, Taiwan began quarantining inbound travelers and close contacts of COVID-19 patients for 2 weeks as early as January. Taiwanese authorities have quarantined more than 300,000 incoming travelers since then, and about 10,000 others whom officials found locally through contact tracing. The government considers people close contact if they have spent more than 15 minutes within 2 meters of people who test positive for COVID-19. Taiwan's quarantines are far more strict than those in many Western nations. Officials track quarantine people's whereabouts using their smartphones, but there are support as well. Officials deliver books, movies, and instant ramen noodles to people confined at home to help ease the isolation. Locals who can't work during quarantine receive a small subsidy of $35 a day. Even the phone tracking is gentler on privacy, relying on approximate location data from cellular signals rather than pinpoint GPS readings. The controls have paved the way for a recovery in Taiwan's economy, which expanded a surprising 3.3% in the third quarter and is one of the few projected to grow this year. There's a lot to be learned from Taiwan, and to give Taiwan a seat at the World Health Organization is a start. That is my take. Thank you for watching. Please leave a comment and subscribe to my channel. Just click the subscribe button right there. I will see you again shortly.